Hello, your braces have been placed today to ensure successful orthodontic treatment. You need to follow some instructions. So, first of all, is that some discomfort will be there. So you have to bear with mild pain or soreness or pressure, and it is there for 2 to 3 days initially, and then it comes down, that is it subsides. So in case if your doctor has prescribed you some painkiller, you can take it, and if it is not required, then also the pain will subside in a day or two. The pain indicates that the tooth movement has started, so there's nothing to bother about. In case of too much of discomfort, obviously you will have to discuss it with your doctor. Then teeth will be tender while chewing. So this is apart from the pain. The other difficulty that the patient feels is that when they are biting normal food, then also the tooth is tender, as if it has been hurt. So that is obviously when the pressure has been applied on the tooth movement starts. That kind of a pain is experienced by the patient. Uh, then eating soft food during the first few days can be helpful. So as it has been prescribed that you can take semi-solid or liquid foods, for first few days till the pain is more, and then as it comes down, obviously you can take other kind of foods which is uh, permissible. So now the question arises, what is hard food and what is permissible and what is not permissible. So the as such there is no dietary restriction, but avoiding hard foods like nuts, ice cubes, hard candies, and popcorn kernels, sticky foods like chewing gum. Chewing gum obviously is contraindicated because it will stick in your appliance and the whole thing will go for a toss, so not allowed. Toffees, caramels, it can be really difficult to clean these things, so it is better that you avoid these foods. And then food requiring biting from front teeth, for example whole apple. So instead of if at eating a whole apple, you can cut it into small pieces. This is applicable for all the kinds of fruits. So you cut it into small pieces and you can have it. And corn or cob not allowed, for obvious reasons. And sugar cane, no, sugar cane is also not allowed. So you can have juice of sugar cane but not sugar cane. Then uh, you can maintain excellent oral hygiene by brushing after every meal, but at least twice a day you'll have to brush. And a special kind of a orthodontic brush is available which is serrated in between, and it has got a proxer brush at the end to enhance your cleaning experience, so you can use that. Then clean around the brackets nicely, and especially when you're going for the appointments, you should have to clean and don't eat in between before you see your dentist. Then use fluoride toothpastes, and interdental brushes and mouthwashes are a must. That should be there in your kit now till you complete your orthodontic treatment. Then, if you develop ulcers or any specific irritation or any allergic reaction, don't rub it against your cheek. Instead of it, report to the doctor and see if there are any pigtails left, or if the wire is poking, then get it reduced. And then avoid damaging habits like biting your fingernails and chewing pens or pencils. This can break the appliance and can increase your treatment time. Then opening packets with your teeth, no, not allowed, or cans, or biting hard objects should be avoided. If a bracket or wire is broken, don't try to fix it by yourself. Contact your orthodontist as soon as possible. Do not attempt to repair. If a wire is working, you can apply orthodontic wax. This wax is available on Amazon also, so you can buy that orthodontic wax, or you can ask from your dentist's office and they'll provide you some wax. In case of emergency, you can place that wax so that it is not immediately hurting your soft tissues. Do not forget to keep your appointments. Go to your orthodontist regularly, because the amount of force that has been incorporated in the implants uh, will be either titrated, that can be done only by an orthodontist, or um, wearing additional appliances are directed. For example, elastics, if the elastics are finished, obviously your supply has to be brought from the dentist office. So these were some of the things that you should keep in mind while taking orthodontic treatment. And I hope the information was of use to you. Take care.